Leader of the third party.
Thank you, Honourable Speaker. The family doctor crisis in our province is top of mind for a lot of people right now. There's 900,000 British Columbians without primary care, and those who are with it are finding their access increasingly cut back. 40% of British Columbians are afraid of losing their family doctor. This government has opened 27 urgent and primary care centres as their solution to this crisis. They're quick to open them, but many lack funding plans and adequate staffing. They're open limited hours, they fill up quickly, and there's gatekeeping over who can use them. They're meant to deliver care for people who are in urgent need. They are demonstrably not the solution for the family doctor crisis. The minister said as much on CBC radio last week when he said, while urgent care is important, the key thing is to build access to primary care. My question through you, Honourable Speaker, is to the Minister of Health. We hear that there have been 1 million visits to UPCCs, but there are two other numbers that are essential for understanding the complete picture. How many of those 1 million visits were to access primary care, and how many people have been turned away from UPCCs?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, since 2018, the government has pursued a primary care plan which seeks to reform primary care in our province by building team-based care in every part of our province. The principal initiative has been what's called the Primary Care Network, which supports existing primary care providers and expanding their capacity to attach, in other words, to serve more patients in a longitudinal way, meaning over a number of years and visits, but also, Honourable Speaker, to provide better access to urgent care as well. So 54 primary care networks, which represents the lion's share of the new staff that have been added, which is 950 across British Columbia. Yes, 27 urgent and primary care centres has served over 1 million people. During the pandemic, those urgent primary care centres were essential in British Columbia because of the absolute transformation of our primary care system that happened on a dime in 2020. They have played a central role. They're not the only part of the plan. We've added new community health centres. We've added new residency positions. We've added dramatically, 3 times the number of nurse practitioners serving in primary care that have ever served before. This is an effort to do that, and we have to continue to do that, and we will.
Leader of the third party, supplemental.
Thank you, Honourable Speaker, and I think there's an interesting trend that we see with this government, particularly when it comes to healthcare, which is a lot about the inputs, but not much about the outcomes. And so we've gone from 700,000 unattached patients in this province to 900,000 unattached patients. We're hearing doctors talk about leaving their practices because the burden on them is too great when they're dealing with fee-for-service and having to run a small business in addition to caring for their patients. I applaud the minister's sense of urgency, but I think what we have to start measuring are the outcomes. And I didn't get an answer to my question about how many people have been turned away from UPCCs and how many people that visited UPCs were actually accessing primary care. So my question, again, through you, Honourable Speaker, is to the Minister of Health. How many British Columbians have been attached to a family doctor through a visit to an urgent and primary care centre?
Minister of Health.
Well, thank you very much, Honourable Speaker. And Minister, once the member speaks of outcomes, I just say this, that this is a transformation that's occurred on fee-for-service visits. In addition to that, we've added the number of APP doctors, alternate payment doctors, the amount by 15% a year in each of the last 3 years. 15% a year. So we are transforming the system. But the member is right. This is primarily a fee-for-service system. Unusual in Canada, 80% of primary care billings are fee-for-service, and that has happened over time, over multiple governments. That's where we are today, 80%. But during the pandemic, talk about the response of the primary care system and the response of the government. In 2018, there were 16,500,000 primary care visits. And in In 2021, the full year, during the pandemic, there were 18,043,000 visits. Now that was a dramatic increase, but it hides the real story, which is we had to, and family doctors had to, on a dime, change the system, such that there were 647,000 virtual visits in 2018 and 13 million virtual visits in 2021. This transformation has happened and it has had a significant effect, including on patients, many of whom struggle with the lack of in-person visits. This has been an extraordinarily challenging time. And I want to acknowledge the exceptional work done by family practice doctors and others. But in that context, the million in-person visits at UPCCs have been incredibly valuable. And I don't think, Honourable Speaker, criticizing them is the right approach. They are part of the answer. No one ever said they were the whole answer. I don't agree with that. At a time when we needed more in-person visits, we delivered 1 million through UPCCs. That was important, and I want to thank everyone in the system, doctors, nurse practitioners, health authorities, and the Ministry of Health for the work they've done together to serve people in the most difficult of times.